ladies and gentlemen. His Excellency the Vice President Alhaji Mahmoud Bawumia, I know he's watching. Showbiz personalities, the media, ministers of state who are also watching us live, viewers at home and on the internet and social media. I bid you a warm welcome to today's event, which is yet another demonstration of what is possible through technology. As you can see, we're strictly observing social distancing and streaming this concert to you in the comfort of your homes and on social media through technology across all the various mediums. Our common challenge today, which is posing an existential threat to us globally, also provides unique opportunities to find solutions to the COVID-19 pandemic and to ensure our continued survival as a people. We're happy to provide you with one such solution, the Ghana COVID-19 Tracker app. The Ministry of Communications, together with other relevant government agencies, are working assiduously to fight against this pandemic that has affected over 150 countries worldwide and brought the world as we know it to a standstill. Experience has shown that one way to combat this pandemic is through technology. Experience from those who suffered from its effects before we did. The Ghana COVID-19 Tracker app is being launched through the visionary leadership of His Excellency the President and his Vice President, Dr. Mahmoud Bawumia, who has also joined us today through the same technology. It is one of the tools being used by the government of Ghana to respond to the COVID-19 pandemic to help keep us all safe. We need accurate data to know where the virus is and is heading towards, to be able to fight it swiftly and in the most efficient way possible, just as has been done in other affected countries around the world, such as South Korea, Taiwan, Israel, Kenya, China, and to a limited extent in Europe and the US. The app seeks everybody's assistance through crowdsourced data to collect as much information as possible to assist the Ghana Health Service to quickly identify individuals or groups of individuals at high risk of being positive for COVID-19, which may otherwise not have been discovered through using the traditional manual sources of data collection. The information collected from the app will help to prioritize health services that are already overburdened, steering them onto the right high-risk areas as early as possible. Several communities may not even know that they are at risk, but using the information that people who share their symptoms with us through the act provide, we'll be able to identify potential high-risk areas quickly enough to let the contact tracing teams target their efforts more directly, more efficiently, and more correctly. The early response efforts will help improve and accelerate the government's response to the pandemic and thereby help control the spread of COVID-19. We're fortunate in this country. We've started testing not just those who are symptomatic, but those who may be at risk or those who may have been in contact with others who are at risk, even if they're showing no symptoms. Currently, that has helped us identify 566 people who are positive. Other countries who are waiting for symptoms to show are having fewer numbers of positive cases. But the benefit that we have is that once we can identify, isolate, quarantine, test, and treat, we're removing the potential pool of those who would be infecting others from the population and keeping them in a place where we can treat them and release them after they prove negative, just as we did with the last batch of people who came in from abroad. Among the many functionalities of the COVID-19 tracker are detailed contact tracing of individuals. We're fortunate. By virtue of the Executive Instrument 63, we can use a platform of all the telecoms companies. Frequent contacts by an individual can be traced through various telephone-related data. The purpose of this, for example, is when a person becomes infected, we can backward trace their contacts through telephone records and location history provided by such records. This helps provide a base to discuss contacts with a health professional so that the individual does not forget any people or locations that they may have been to. This can also serve as a guide to determine if somebody needs to be quarantined based on their contacts and locations that they have been to. The information provided can include any foreign travel, frequently called numbers, or friends of friends. As detailed above, the tracker can also provide information about people that were at the same event, same location, same country, or other defined location-based function as to where they may have spread as a group over time, so that we can follow them if indeed one of them tests positive for the virus. It can also provide information about periodic lists of telephone numbers or individuals that are currently or recently have been in certain countries around the world to the Immigration Department for possible use in determining whom to provide an extra layer of screening. This will come in handy when our ports of entry reopen, as they are bound to in time. If certain individuals are also required to self-quarantine, the tracker can provide information on the relative reliability of the quarantine. That is, if the individual is complying 20% or 80% within their current quarantine area, or is going out to Accra Mall to shop and come back, as has been noticed with some of those who have tested positive currently and have been asked to self-isolate. Unfortunately, not all of them are following the self-isolation guidelines, and some are behaving as if we are in normal times and are going out, hanging out with friends, and possibly infecting those as well. All the measures that have been put in place are for our own good, and we really ought to respect them if we are to have our collective peace of mind. The features of the application also aid in checking for COVID-19 symptoms and relevant risk factors. It answers frequently asked questions, subject geographical location, and provides digital assistance as well. Let me reiterate the fact that the system's data is encrypted such that no personal information, name, ID, or address is recorded on the platform. We are mindful about the privacy of the potential victims and of all of us. Now, one feature that this app provides is that it can also send outgoing SMSs to text messages to high-risk individuals who've been identified by any of the above reports, and which will direct people to the app and the USSD portals to fill in their current medical status. Once you are identified as a potentially high-risk individual, the app itself will send you a text message to check your symptoms and then provide you with information as to what to do, and send that information to the health authorities as well, so that they can follow up on you and provide you with the assistance you need, so that the entire populace can also be protected. The app does not provide medical advice, nor does it provide information on medication. It is an information tool to help all of us to stay safe by providing some basic information and tracking those who might have been infected and providing them with help. I'll therefore entreat all of us to download the COVID-19 tracker app. Those of us who do not use a smartphone can dial *769# and will receive information in 5 major Ghanaian languages: Twi, Ga, Ewe, Hausa, and Dagbani. We encourage all of you to download the app or access the *769# USSD code and follow the prompts. It would take an average of 2 minutes to complete it all. Now, it is important that we follow the simple protocols that we've already been notified to do. Wash your hands with soap and running water. Use a sanitizer as often as you can, but I prefer that we wash our hands with soap and running water, which is more readily available to everyone. Wipe down the surfaces that you touch as frequently as possible. So even though I know this lectern is sanitized, before I leave, I will use the sanitizer. It's important that we also stay at home if we don't have any business being outside or are not an essential service worker. The app cannot move if we do not move it and allow it to spread. Now, some of our most densely populated areas have also been identified with positive cases of the application. Mamobi is one. In my own Ablekuma West, some cases have been identified. So let's not sit there and say that, no, this is a rich person's disease. It can never affect us. We never know whom we may come into contact with if we go out. We sit in a car. We interact with people at meetings. Even in this room, we don't know who has been where a positive case has been. So it is critically imperative that we stay at home if we don't have any business being outside. We need to stay safe for ourselves, for our families, for our communities. Even countries with better equipped health systems are at breaking point. Ours needs help. Thank you for your kind attention. Please enjoy the music from our performers. Some of us are joining us remotely in line with social distancing, and I must thank all of them for also contributing to the success of this virtual concert. And it's Easter Monday as well, so afishiapa to us all. Let's stay home and stay safe. I thank you all for your attention.